and the only person who was completely against that was my grandma. And my grandma forced me to apply for a job at the university. So, and that's why I put her phone number on my application letter. And she was the one who maybe arranged everything. She arranged my invitation. She arranged my contract, my job, so everything. And this was maybe the beginning of my journey to otolaryngology when I specialized. So it was my grandma.
Ladies and gentlemen, welcome to another episode of the Rhinoplasty podcast with me, Dr. Cameron McIntosh. We're in the month of June, and it has been enabled by Vectra from Canfield Scientific. If you don't know what a Vectra camera system is and the 3D morphing it does, you better Google it, because these guys are absolutely next level. So I'm very excited for today's podcast, because this is a guy who might not know, but for more than a decade, he's had an influence on my life. He was one of the first chapters I ever read in a remarkable rhinoplasty book by Anthony Sclafani called Rhinoplasty, on this whole functional side of rhinoplasty. And it's an absolute honor and privilege to have Werner Heppt all the way from Germany on the episode today. Werner, thank you so much for being on today's episode.
Yeah, it's a big pleasure. Thanks for the introduction.
Awesome. So Werner, there's lots to chat about. We've been listened to in more than 70 countries around the world, and the first thing I'm really interested to know is just tell me your journey about where it all started and how you ended up taking over from Enrico Robotti to become the president of the Rhinoplasty Society of Europe. It must be an amazing journey that you had.
Yeah, I think in the interest in let's say in ENT medicine and otolaryngology, and started in my studies, of course. But at that time I was not that interested in facial plastic surgery, but more in oncology. And maybe that's why I did my thesis in oncology. And so after I finalized my studies, my decision was clear to go into a specialization in otolaryngology, and not in facial plastic surgery. But frankly, after graduation, I didn't know if I should immediately apply for a job, because I was at that time a ski instructor, a tennis player. So I thought it would be an option, an alternative to get money from that. So, and the only person who was completely against that was my grandma. And my grandma forced me to apply for a job at the university. So, and that's why I put her phone number on my application letter. And she was the one who maybe arranged everything. She arranged my invitation. She arranged my contract, my job, so everything. And this was maybe the beginning of my journey to otolaryngology when I specialized. So it was my grandma. And yeah. And my letter boss, they were so sympathetic, and all the time he asked me, what's about your grandma? So that was a kind of relationship. But anyway, it was good for me, because then I started my specialization at the University in Heidelberg in oncology. I did my habilitation, so it's in a way a PhD for professorship. And then at that time, I started with my rhinoplasty work and facial plastic surgery. But I wasn't that interested only in doing that, because in Germany, if you want to apply for a head of a department, you have to deal with all fields in otolaryngology, also in otology, which is next to oncology, maybe the most important issue. And that's why I changed from my home university, from Heidelberg, to a medical school in Hanover, to do ear surgery, exclusively ear surgery. So I did cochlear implants, I did all this kind of stuff. And even at that time, because I was quite experienced when I came from Heidelberg with otoplasty, not only otoplasty, rhinoplasty, plastic surgery, I maybe my journey in rhinoplasty went on not only with otology. And then finally I applied for a department. And fortunately, it was in 1996. I got the job here in the clinic. So I got the boss of a clinic of otolaryngology, head and neck surgery, and facial plastic surgery. And that's why at that time I was quite young. but I could focus more on my bias, and my bias at that time wasn't anymore oncology. It was cochlear implant surgery, e-surgery, but more and more rhinoplasty, and that's why I focused from that time, because it was easy for me, because then I was the head of a department to invite maybe famous doctors, and then they taught me, and especially Klaus Walter from Switzerland. So he came several times to my clinic. We had in a way an exchange program, mostly for me, but also for my residents. So it was a close relationship at that time, and was very fruitful. And this maybe was the beginning of my rhinoplasty career. So let's say after oncology, after otology, I jumped exclusively right now in rhinoplasty.
Wow. But Werner, you're still the head of the department. So do you have other people who are doing the otology and the oncology underneath you?
Yeah. So right now we have a department system. So we have a section for oncology. They're doing the microvascular flaps, reconstruction, all the larynx and hypopharynx tumors and oropharynx and so on. Then we have a section for sinus surgery, skull-base surgery, and also for otology. And for otology, we do cochlear implants, but I don't do it anymore. I mean, because I'm so focused on facial plastic surgery right now. But I have good colleagues, and we all work together. But of course, I have to leave these fields because you can't deal with everything.
Of course. Okay, I'm gonna circle back just now to another thing. Carrying on the academic side of things, I know one of the passions you have within rhinoplasty is objective and functional testing of the nose. Maybe you want to tell the listeners a little bit more about that.
Yeah, the functional testing. So I think I was always upset with the diagnostic tools in rhinology, because we don't have any objective measurements. If you want to assess exactly what's about the function, there's no rhinomanometry and acoustic rhinometry, so you don't have a reliable tool. You can't check it, and that's why we early started some investigation with this airstream simulation, and it's very nice. And even now I keep on doing that with a colleague in Switzerland, with a colleague in Berlin. So we have a research group on that, and we do right now airstream simulation as in a way as evidence-based medicine in rhinoplasty, and not only in the functional rhinoplasty, but also in aesthetics, of course, because if you make investigation of maybe the isthmus or the valve area, you are in the mid of the tip of the nose, and of course everything influences not only the function but also the aesthetics. So it comes together, everything, and it's very interesting, because I think this is for the future so fruitful to do this kind of research, because this is the first clear and real objective reliable tool for me.
And so the question is, how affordable is it for the general rhinoplasty surgeon? Because you're sitting in an academic institute where you can do this computational fluid dynamics and airflow testing, but I use 4-phase rhinomanometry on every patient, and yes, I've got a cone beam CT scanner to help, but it's still not what I want it to be. And do you think we'll get there one day?
Yeah, I think sure you will get that. I mean, right now it's not easy, because you need a high resolution CT scan, and with all these data, you can do this combination fluid dynamics. So numeric simulation could be done with high resolution data from the CT scan, but you can't do it by yourself. You need a big computer, and it takes a long time right now. And maybe in the future, the computer are getting better and faster. And I'm sure that big companies, maybe Philips or others who sell the CT scans and even MRIs, very interesting in the future, they should combine, and I think they will combine, because then they have both. They have morphology and they have a functional information, and that's for everybody would be helpful. So therefore, yes, I think my hope is that providers or constructors of CT scans and MRI scans will jump on this boat and combine that this functional work as well.
Yeah,
it would be perfect.
That'd be great. Now, Werner, a few months ago, I was in Bergamo, where you became the new president of the Rhinoplasty Society of Europe. I mean, congratulations. It's absolutely great. I'm so excited for your enthusiasm that you're going to be bringing. Like, I mean, Enrico is enthusiastic, goodness me, but to now fill his boots. So, yeah, tell us a little bit more about that exciting new role that you're playing.
Yeah, exactly. So it's not only Enrico. I have to follow it. The founding member of the president was Wolfgang Gubisch. After Wolfgang, it was Nazim Cherkis and Enrico Robotti. So big footsteps I have to go in. So
Yeah, yeah.
that was in the beginning. I was quite concerned when they elected me to get the next president. So how could I arrange that? Even I'm hardworking, but it's not easy to gain that level that Enrico, for example, with Bergamo course and Nazim set. So, but anyway, I think it's so fascinated in this new society. So it was founded, I think, 11 years ago, and now it's increasing, it's growing, and we have so nice people over there. We have discussions, so we have more than 600 members right now from more than 65 countries, and it's growing and growing. So it makes a lot of fun, and it's really for me a great pleasure. I'm so grateful to work with all these brilliant friends and guys, and even this time right now, it's so interesting, because after that period of sleeping of beauty, where nothing happened in rhinoplasty, we have since a few years we have with unbelievable development, and this development also is brought in these societies, and therefore it's absolutely not boring right now. We are on a wave, of course, and we have to settle down. But on the other hand, it's so important right now to assess the techniques, to get idea what's good. Especially we have to take care of our young people, of our residents, not to misguide them, because they hear everywhere go only for preservation rhinoplasty and leave structural ones. So I'm a bit concerned that young people get confused in that, and but you hear that all the time. And we launched a fellowship, and the first question of these guys were where I can have a look to preservation rhinoplasty, and I told them, okay, hold on. I mean, rhinoplasty preservation type, it's only maybe 10% of your clients, because and 10% if you have a hump, of course, maybe a mild or moderate, the nasion is perfect, the dorsum is nice, and the tip is not absolutely twisted. It's perfect because you don't touch the skin, everything is fine, and it's also quite quick, and there's no need to reconstruct, that, or for the middle wall. So but the point is right now, because everything is filled with this preservation thing, especially the dorsal preservation, and I think in the teaching and in the taking care of our young colleagues, we should a bit focus more on all the other techniques, not only structure one. We should come from the base, from the septum, and we have to teach them how to fix maybe a deviated septum to the bone, making a drill hole through a premaxilla, how to deal with the most common deformity of a septum, the caudal deformity, and to teach that, and then step by step, not maybe begin with the dorsal preservation and then a hump reduction. I mean, we did that. I was taught by my teacher in the beginning a letdown technique, and I was so frustrated because I didn't understand the procedure, and I had so bad results in the beginning that I left that completely. But this is the only concern right now, and from the society's task in the future should be not only with the experienced guys, the discussion, but also to guide our young colleagues in the right direction.
100. So Werner, two questions I have around the society for the listeners.
Yeah.
So the guys who are listening from anywhere in the world, maybe it Malaysia or wherever, how do they become members of the Rhinoplasty Society of Europe? I mean, I've been a member. I love it. I come to the meetings. It's an incredible society. But how do people actually apply for membership? And can they, if they apply, will they automatically become members, or are there certain criteria they have to fulfill?
Yeah, I think if you go to the homepage, there's an application form, and you should be. There's no need to be a specialist. Even at your late term in residency, you can apply for that. But you need two people who give you the credits, and then you can apply. And all applications go to an application committee, and they will they only have a look to the application. And then you even if you come from Asia, from Africa, from everywhere, I mean, you can get a member of the Rhinoplasty Society of Europe. And we have many people from other countries, not only Europe's, and also for our. It's so nice that for our first fellowships, we selected 5, and I think only 2 or 3 are from Europe. So we have one from Peru, we have one from Kuwait, or from Egypt. So we are open.
That's awesome. Okay, so Werner, now for the really exciting question that I have. This apparently there is a really cool meeting happening next year. So in many ways, this meeting that you're going to tell us about, the first time it happened was in Versailles in 2016. And that's where, through Peter Scott, I got to meet Rod Roerick, who invited me to come to Dallas, who said to me when I was in Dallas, Cameron, man, why don't you have a Rhinoplasty Society in South Africa? I came back to South Africa, reached out to a couple of my mates, plastic surgeons, ENTs, and we started Saucer. And about a year or 2 later, Saucer just exploded with doing lots of cool webinars, etc., etc. But I'll never forget that first ever international meeting, the IMR HIS meeting in Versailles. And Barman Gairon being the keynote speaker who stood up at the first time ever. And I heard about all these guys and seen their names. And he shows these 3 photographs of before and after, beautiful results, and asks the audience if they can see the difference. And obviously we can see the difference, but he says, no, look very carefully. In all of the first 3 photos, their mouths were slightly open because they were breathing through their mouths, but in the second, their mouths were closed. And he said, if you don't fix the function of the nose and get that septum right, no matter what you're doing, don't do the rhinoplasty. And that really had a big impact. So that's talk and the Congress itself. So tell us about what's happening next year in Berlin.
I think also you talk as somebody who comes from otolaryngology. That's Frank, because and I think this is a bit difference between the plastic surgeons and the otolaryngologists, because we come from the bottom, let's say, they come from above, and the interesting thing is that maybe in these meetings, as next year in Berlin, this is a 3rd international meeting of rhinoplasty societies of the Europeans and of our sister society in the United States. We have everybody, so we focus on function, we focus on aesthetics, we have plastic surgeons, we have otolaryngologists and facial plastic surgeons. And I think the next year will be especially interesting, because now we get more and more experience with these new techniques, with all these how to do your subdorsal strip, your strip, your Cottle technique, maybe the one Milos and Dean published. So it's really interesting. What is the best, and to have this discussion. I'm very, very happy to have these discussions then. And also I think next year it's the first time we get, let's say, a bit bigger concerning the societies, because in the future, that's why also you got an invitation, and people not only Sosa from South Africa, but also South America is important. We have brilliant surgeons from South America, from Brazil, unbelievable. We have in Asia excellent people. So that's why we took the decision to open the society and to open, let's say, IMRISH for a broader community. A broader community means So it comes from us, from the Rhinoplasty Society of the United States, and from the Europeans. But I think in the future we should get broader and we should integrate everybody, because everybody can learn from each other, and it will be so fruitful in the future if it's not the whole world. Okay, we have some spaces left, but anyway, the policy next year will be with an unbelievable faculty. I think we more than 50 persons get an invitation worldwide. So the two societies expand the fields, and that's why I'm very curious about next year in Berlin. And I mean, Berlin is a perfect place. Berlin is the home of Jack Joseph, who was maybe not the first, but maybe the second, who published Rhinoplasty and in this famous book. And he worked in the Charité, and one of these evenings will be in the historical hall in the Charité. It's very, very, very interesting. So there will be a gathering, and the whole meeting will be in the middle of Berlin, next to the Brandenburger Gate. So it's a fantastic area. It's not in the Adlon as 2 years ago. We planned before COVID. It's now in the Steigenberger, but it's next to the Brandenburger Gate, where the Chancellor is, and so we are in the mid of Berlin. So therefore, I hope that everybody will be content and will like that. And of course, Berlin.
Guys, listen to that.
Yeah.
The listeners on this podcast, you cannot miss next year's IMR HIS meeting. So it starts on the 30th of June next year till the 3rd of July. Whatever you do, get there. There isn't going to be a Bergamo meeting next year. If you go to IMR HIS, it's IMRHIS2023.com, that's going to bring you to the website. So make sure that you go there. Okay.
Thanks.
So, Werner, let's ask you another question.
Sure.
I mean, I'm so intrigued to be talking to the professor of otolaryngology department. I mean, that's when tell us some funny stories that might have happened to you in your career. On the one hand, and the other hand, when things just went really wrong, what is it that, because you didn't just you had to work extremely hard to get where you got. So I'm interested to know what gives you that will to want to carry on improving yourself day in and day out.
Yeah, Cam, I was afraid that you were going to ask me that, where I get my energy, but I think the key, I don't know. I mean, I have maybe some medical genes, because in my family we had ophthalmologists, we have orthopedics, we have dermatologists, and I'm the first ENT guy. But anyway, it's not only genetic. I think you need passion. You need you must be crazy in a way. And if you do your work, if you love your work, you get so much energy from that. And maybe that's the key. If you have a passion, if you stick to a problem, if you try to get better and better, and are not frustrated, you get so much energy, and it's like a fulfillment. So for me, maybe that's my source of energy. And when I'm in the OR, I feel happy. I don't feel stressed, and I think, I don't know who mentioned that he is so happy in the OR. Was it Göksel or somebody? Yeah.
Göksel's happy always.
Yes, he's always happy when he has wine. Yes. Wine, okay. But anyway, it's even me. I like wine. Red wine from your country, from Boschendal.
Yes.
It's the best is.
I will bring you some red wine next year to Berlin then. Okay, from Boschendal.
But please, Ladybird from Boschendal. Okay.
Okay. Perfect.
Okay, skip it from the podcast. Anyway.
Okay, another question for you. What do you do when you are not doing rhinoplasty?
Yeah, when I do not rhinoplasty, that means when I'm not in the clinic, I have to deal with my private clinic. So I opened the private clinic in Baden-Baden together with my wife. She's a dermatologist. So we do a lot. Let's say the clinic's name is Skin and Face. So we not only do No surgery. I learned a lot from them in skin treatment. So therefore, I will be there. But when I'm not on work, I try to recover and to get my other part of my energy with my family. Of course, at the weekend it's absolutely reserved. And within the week, I like to play tennis, and in winter times I go skiing. So skiing for me is one of the best opportunities to get more energy. So I like doing sports, and sports is for me another must. Not every day.
Yeah.
I try to do it. I'm not in the I don't have the opportunity as you to swim, and but I can jog. We have some pools here, so but anyway, to do sports and to bike, and this is maybe this is another key. And yes, and wine, as all you other guys, red wine, white wine. We have here. It's a nice area for white wine. Okay,
Wow.
that's my plan.
So, Werner, I actually spent a lot of time in Germany when, in my previous life as an athlete, I used to live in Augsburg.
Yeah.
On the ice canal. We used to paddle there. It was wonderful time. It's a country I love so much.
Yes, I heard about that. You were in the Olympic team of South Africa, isn't it? Or
Yeah, for slalom kayak
slalom
fahren.
kayak.
I used to
Okay.
speak some German, but I've lost all of that.
Yeah. They have good facilities to doing that. Yeah, it's great.
Okay, so I want to end it off with one last item we started to talk about, but I really want to hear a little bit more about what you think. And this is this whole preservation side of things. It's a hot topic at the moment. We did a really interesting podcast with Prof. Wolfgang the other day. He actually gave a talk at Peter's meeting at the European Rhinoplasty course in Brussels. And then I thought this was such a good talk. I wanted to hear what Prof. Wolfgang had to say. So maybe share some of what your thoughts are at the moment around this to the listeners.
I mean, we have the same, let's say, try, because one of our teachers was Klaus Walter. That's why Wolfgang and myself, we think similar. We are we don't do the same type of surgery, but we think similar. So therefore, I think I'm happy that we have this wave, because we got new ideas. It was an innovation, and it was absolutely a must that we have these publications from Roland Daniel, from Yves Sabon, and from Boris Chakir. And so, because we have to rethink, and we have to reinvent the old techniques we all know, and we can't say, come on, the techniques 100 years ago are bullshit. They are not. But they have to be revised, and we have new instruments. We have piezo with the option of delicately do our osteotomies. We can remove some lateral wedge resections and calculate how much on that side, how much on that side, to correct a deviated nose. We have the scraper of Boris, which is perfect for me to do this upper osteotomy. I like so much. And so we have new tools, we have the power instruments, we have new drills, and we have a new sophisticated thinking, which focuses also to anatomical studies. I mean, even in the older days, we had anatomical studies, but the anatomical studies right now, for example, from Peter Palhasi and from Ingalina, from Sicily, it's unbelievable. I mean, this quality we never had before. So that means we have new instruments, we have more knowledge on pathology, on anatomy, and we have a bit more of this open discussion, and we are completely open. That's why I think you mentioned that the learning process is completely different, because we can talk in webinars, and you can have a look to even the big bugs, how they deal with the letdown and maybe a setplasty of the septum. So you can see immediately, and then you can rethink, and then you can digest, and you can go into the OR and perform. And that's a good thing. On the other hand, I think the indication for this, let's say at first the dorsum are limited. And I was so surprised in hearing the last podcast from Theo. I like him so much. He's such a nice guy. But he's doing exclusively primaries. And maybe my patients are as not that Wolfgang wants, but I have 70% maybe secondaries. I have a lot of ribs to do because I have tertiaries, quadraries, and I'm so happy when I see a primary hump. It's paradise. I mean,
with a straight
with a
septum.
straight septum.
I mean,
exactly. Yeah.
Exactly.
With not a deviated septum, you see, and they can't breathe. You can say, okay, a small maxillary crest, a little turbinate reduction for breathing purposes, but a slight, a nice skin, and it's such a delicate, nice surgery, and the outcome is really brilliant. So I'm for those patients, for the primaries, nearly straight septum, maybe a bit turbinate work, and a straight line, not a Carnot shape. I don't think that the Carnot shape will work. Not a deep nasian, and not an ugly tip. It's brilliant. Therefore, I think the same as Wolfgang. So I think we have different clients. We have different maybe experiences, and I had the same. Maybe that's why we think similar. I mean, Wolfgang is a bit older than me, but I was trained by Klaus Walter, and he never in his life opened a nose, and he was the best surgeon I know, next to Tony Bull and maybe Cintardi. These were the masters when I learned everything. And even Tony Bull was such a good surgeon, and they never opened a nose, and really unbelievable. And then we changed because maybe 15 years ago we opened the nose. We saw that from the plastic surgeons, because nobody in the ENT area was allowed to open the nose. This came from the plastic surgeons, mostly in Germany from Wolfgang. So I learned that from him, and because it was easy to learn it from him, because he's one of my best friends, and he showed me everything, so I understood. And then now I again changed, because I did nearly completely 100% open rhinoplasty. Now I changed in these 10% indications to closed rhinoplasty. I don't do the Goerxels thing. When I have an easy case, I do my osteotomies, I remove my subdorsal strip and do everything. But it's maybe it's a bit less even in my office than 10%. But everybody should be happy who has more than 10%. And these are the pearls in rhinoplasty. But on the other hand, we shouldn't talk not only about the pearls. And everybody who is doing that should know how to reconstruct anything, because if you do something, you have to deal with your complications. And if you don't have a close friend or somebody, maybe your teacher, who helps you when you have a disaster in your follow-up, it's not the best, but you have to learn to do your complications by yourself. That's my credo. And that's why I'm a bit concerned that everybody only jumps on this dorsal preservation, which is really, I don't object against that. It's perfect. And even the thinking that you preserve the scroll area, the vertical and the horizontal ligaments between the upper lats and the lower lats, it's brilliant, because that's preservative, not here in the dorsum, but in the valve area. And this is so important, and that's why I'm so happy that everybody taught that. But I think we see right now more and more complications. I think one of my most challenging one is on my surgical schedule, maybe in a few weeks. A lady who got 2 times a letdown because of let's say a mild to moderate hump, but the complete bony framework has sunk in the nasal cavity right now. So from the outer appearance, it looks right now like a dish face, like a trauma. From inside, everything is in. So it's a huge, let's say, bad influencing of breathing. So and to do that after 2 letdowns, with big removal of the frontal process of the maxilla and of the nasal bone. That's the thing, and you have to do that. And I think for these revisions are much more complicated than other revisions. So it's for me, it's not 100% that the revision of a preservation rhinoplasty is an easy thing. Mostly it's an easy thing because the complications mostly I see is maybe a recurrence of a hump. It's not a big thing. You can deal with that, even if you do it from the surface. But these dish faces, these sunken in complete nasal framework, these are the bad stories, and they are not very common, but I see them more and more. And I discussed it also with Enrico, and he's also a guy who's doing a rib reconstruction, and these guys who are doing a lot of reconstructive surgery, they see these complications, and to revise it, you have to redo all the osteotomies. You have to bring it up. Maybe you need microplates, and you need rib. You need everything, and it takes a long time to do that. And you have to restore the inner lining, the nasal cavity. Therefore, I mean, these are very rare cases I see right now, fortunately. But these are heavy cases, and nobody should think everything is charming, everything is quick, it's easy money job. So let's say 30 minutes, 45 minutes. It doesn't. Sometimes I'm so upset when somebody says, okay, it's only 30 minutes. What does it mean, 30 minutes? What counts is the long-term follow-up. It's a good result and a very low complication rate. No matter what's about the time. The time comes when you get more experience, when you get maybe more cases, but we should be a bit more careful. That's why I think in the same way as Wolfgang does. So perfect idea. Big merits to all these people who did that. Big merits to people who published that. Maybe mostly the group of Yves Sabon. But we have to take care.
Yeah. No, Werner, that's I think I can't add anything. One last question I have for you. Cone beam CT scans. There kind of almost seems to be a reluctance about scanning a patient beforehand. I think it's essential part of our armamentarium before any surgery that we have to have a CT scan of the nose. You've got to see what's going on there.
Yeah, sure, absolutely. For me, it's a must. I mean, this is also a must then to do an endoscopy. I mean, you can't do a nose job without endoscopy because maybe there's a septal perforation behind, and you do a nose job, and somebody turns up with a saddle nose deformity, and you did everything right, but the conditions were so bad that it was not your fault. So to do that endoscopy, and of course CT scan, because I think there are so maybe functionally important pathologies as a concha bullosa or a piriform aperture stenosis, which is a bad pathology concerning the breathing and more, and therefore for me it's a must. It's not a CT scan. A cone beam CT would be the best.
Absolutely, yeah. That's what we've got here. Well, guys, this has been so interesting to listen to Werner. Werner, thank you. Shout out again to Vectra, who enabled this podcast. Guys, make sure you get yourself one of those cameras. You got to get a cone beam scanner. You got to get a Vectra camera. You got to do functional testing. You got to look in the nose, or go and do something else. But yeah, thank you very much to all the listeners from around the world. Guys, we really appreciate your support. It's been so encouraging how many people listen to this podcast. Please come back again next week to listen, and send me any questions, etc. If you have, or other people you're interested in interviewing. But Werner, from my side, and from I guess all 600 other members of the Rhinoplasty Society of Europe, we're thrilled that you're our new president. We really hope things go well, and we're looking forward to seeing you in Berlin next year. Would
be a pleasure, and thanks for having me.